My name is Kathryn McIsaac, and I'm a PhD student in epidemiology at the University of Toronto. My presentation is about the effect of food insecurity on the breastfeeding practices of Canadian Inuit. Food security is an important public health concern in Canada's north. Research indicates 60% of Inuit households in the north are food insecure. Fewer households, however, report childhood food insecurity. This supports the notion that adults in food insecure homes will compromise their own needs to provide for their child. Breastfeeding is the most cost-effective means of infant feeding. However, less than 40% of Inuit children receive exclusive breastfeeding to 6 months, the current recommendation of Health Canada. Our research is the first to examine if food insecurity explains variations in exclusive breastfeeding practices among Canadian Inuit.